Hey, Brian and Usma, how are you doing? Hello, guys. Am I audible enough? Hello, audible. Hello, Brian. Can you get me, or can any of you can get me? Just unmute your mic and say, "Can get me." Hello.
Yes, Judith, I can get you loud and
Hi,
clear.
we can hear you.
All right. Thank you. Let me just wait for more people. Then we'll start at exactly 2015. Okay, so wait. I don't know if we can wait for another 5 more minutes. So if I can start, you can just give me a go ahead. So guys, can I start? Or we wait for more people to join in?
I think we can start.
All right. Let me just start sharing the screen. Kindly just mute your mics when you join in. Just mute your mics. So I don't know if can you just unmute someone to just confirm that they can be able to see the slides that I'm sharing right now. Brian, can you confirm if you're able to see the screen, like the slides?
Yes, we're able. For me, I can see.
All right, perfect. So for today's lecture, we'll be focusing more on the lecture for 4 and 5. We have combined them together because we noticed that 4 and 5 were actually covered partly, or most of them were covered in the previous lectures that we had. So we are looking at working with communities and schools on menstrual health hygiene. So on working with communities and menstrual health, on working with communities and schools, we'll start by getting started, then look at the practical menstrual health hygiene interventions at community level, then again go to getting started, then look at the practical menstrual health hygiene interventions in schools. So we are basically looking at how we can work with communities and schools in relation to menstrual health hygiene. So getting started, the community, what role can the community play? Or I'm giving this information especially for us menstrual health hygiene management educators, so that you know how can you work with the community. If in your outreach you decide, okay, I want to focus on a particular community, how can you work with the community? You can work with the community by one, breaking the silence, by confronting dangerous myths and taboos and practices and changing negative perceptions. We talked about the dangerous myths and taboos that have been in existence from different countries and cultures in relation to menstrual health hygiene. So you can start by breaking the science by actually educating the community on the dangers of the certain myths and taboos that evolve around menstrual health hygiene. And then another thing you can do is actually sharing information on good menstrual health hygiene practices with the community and ensuring that adequate and sustainable access to community water and sustainable sanitation facilities are made available. That is what you can do. And another thing, if you choose to say your outreach program will involve working with the community, you can actually involve women and girls in decision making about water and sanitation facilities. If you want, you can even actually plan for an outreach program where you invite women in a particular community, let's say mothers, grandmothers, as well as young girls, to actually educate them on menstrual health hygiene. Another thing is the community can do when you're working with the community, or the role that the community can play, because you as a menstrual health educator, you're actually a member of the community. What you can do is ensuring that schools support girls and female teachers to manage menstrual health hygiene with private and secure latrines and methods or facilities for the safe disposal of sanitary pads. But then you might ask, but then how can I help in ensuring that schools support girls and female teachers? You can do so by engaging with the school authorities and also just elaborating on the importance of making these facilities available for girls and female teachers. So you can engage with school authorities and see how you can work with each other by actually giving them information on the importance of making available these facilities to female teachers as well as to young girls. And also ensuring girls and women in vulnerable situations are able to manage their menstrual health, menstruation hygienically and with privacy and dignity. When we talk of women in vulnerable situations, we're talking of women that are disabled, women that are homeless. So you can also try to engage with the community. Yeah. And also encouraging the establishment of small local businesses that make sanitary products, or ensuring shopkeepers sell affordable and accessible alternatives. So you can encourage small local businesses. You can engage maybe, let's say, with a tailor who makes usable sanitary pads. You connect them to an organization, or you equally purchase from them and also advertise on behalf of the tailor to say there's actually a woman, let's say in Mansa, who makes usable pads. You can engage with her, you advertise on your social media page and give contact details. That is another way you can help out as a menstrual health educator. Now let's look at practical menstrual health hygiene interventions at community level. What are some of the practical menstrual health hygiene interventions when it comes to community, at the community level itself? So possible menstrual health hygiene interventions at community level will involve: one, promoting good practices. You can talk about the good practices in terms of how girls and women can take care of themselves during their menstruation, and also challenging myths and negative practices, sharing information, basically what we have literally covered in the previous slide. But then another thing you can do is actually sharing information with men and boys so they can support female family members, friends, and colleagues. You also sitting down with boys. So for men, if you feel like approaching adolescent girls would not be a better route for you as a menstrual health educator, you can actually engage with a group of young girls, a group of young boys, to actually share information about menstruation and how they can come into play in supporting female family members, friends, colleagues. It could be wives, siblings. Yeah. And another thing would be distributing low-cost sanitary products. Distributing low-cost sanitary products for sale as an income earner for female community workers. So you can actually distribute sanitary products at a lower price. That way, you're also helping out female women and girls in the community. Another thing is improving community water, sanitation, and hygiene. By, let's say, putting up proper facilities for water, boreholes, taps, but I know as an individual you cannot do such, but then you can engage with the local authorities and see how well you can work around making sure that water is made available in a community that you are found in, so that it's made easier for girls and women to have access to water. And then another thing is improving public water, the same thing, and sanitation and hygiene. Basically, you improve public water facilities, public sanitation and hygiene facilities in the community centers, in the marketplaces. You can advocate for that in a religious institution to ensure that churches have actually the proper water, the proper water supply, proper toilets that have been put in place in schools and health centers, so that they are more menstrual health hygiene friendly. Now let's look at, we have been talking about menstrual health hygiene for women and girls, but what are some of the benefits of good menstrual health hygiene for women and girls? The benefits is that good menstrual health hygiene enables women and girls want to continue with their daily lives with minimum disruptions during menstruation. When they have access to proper information on how they will take care of themselves, you find that they will have minimum disruptions, and for that they will be able to contribute properly in their community, in their homes, in their workplaces. And then also it helps them to stay healthy during menstruation. We know we have talked about how unhygienic menstrual health hygiene practices can also bring about other health risks to a woman or girl. So if they have good menstrual health hygiene practices, it will help them to actually stay healthy during menstruation. And it also helps them avoid embarrassing or stressful situations where menstrual blood leaks onto the clothing, because you have actually offered them on the good, you have talked to them about the proper products that they can use during their menstruation. It will help them avoid, also that will help them avoid embarrassing or stressful situations. Yeah. And then another thing, it actually helps them to stay in school or continue to work during menstruation. You find that most women run away from work. Some girls don't go to school when they're menstruation, but then when they have access to good menstrual health hygiene practices, it is easy for them to stay in school. And if they stay in school, it means no one will be left behind in terms of learning. So now let's look at some of the good practices in providing menstrual health hygiene guidance to girls. What can you do when you're engaging with the community? One thing you can do is you can train mothers, teachers, and other trusted adults who can provide menstrual health hygiene guidance to girls. So I know we talked about from the beginning, we said we want to engage with schools. So another alternative could be you can put up community mothers and train them. Because one thing we have discovered throughout this course where we have been talking about menstrual health hygiene is that there is actually lack of proper knowledge even among mothers and women. Hence, it makes it harder for them to actually even share knowledge to the young girls. And then there's that stereotype to say women actually can't even openly communicate with the young girls in issues relating to menstrual health hygiene. So if you can train mothers and teachers and other trusted adults on the importance of actually educating or teaching young girls on proper menstrual health hygiene, then you have done a perfect job as an educator. Another thing is you can incorporate girls only menstrual health hygiene learning and discussion sessions in schools. You can go to schools and request to a teacher to organize for you a class for just young girls where you can actually get to have an open discussion on issues relating to menstrual health hygiene, and also just get to understand what they know and the information that you can share with them, and also just get to understand and then another thing that can be done is incorporate menstrual health hygiene into the school curriculum. That is another thing that you can do. And another thing that can be done is you can establish youth clubs with girls' menstrual health hygiene discussion groups. You can actually establish youth clubs. It could be at school, it could be in a community setup where you can establish clubs with girls on just menstrual health hygiene discussion groups. Okay, so I've been disturbed. I don't know. Can someone just unmute to notify me if they can still get me?
Absolutely, we can get you. Though we are seeing your notifications.
I know. I fact an incoming call. That's why I'm asking. Let me just admit one more person. Okay. So we are still discussing on the good practices in providing menstrual health hygiene guidance to girls. You can also use trained female instructors to run girls-only session at religious institutions such as mosques, churches, temples, synagogues, on providing menstrual health hygiene information. So another route you can take is actually where you engage with the religious institution. You can go to a church and request if they can allow you to have a session with girls on menstrual health hygiene, where you can educate them on menstrual health hygiene practices. You engage with the pastor, make a program with them. That is another route you can take. So another thing is you can identify supportive female adults who can be available to answer girls' questions, particularly important for girls-headed households or other things. So you can actually find someone there, nice adults that are very supportive in our community. You can engage with them and see how they can come in to assist you in answering those questions. If you feel like you tackling the questions by yourself would be very uncomfortable, so you can actually identify a supportive female adult who can be available to answer the girls' questions relating to menstrual health hygiene. So now, when you came in into this course, there was the course the program you applied on was the pure dignity program. So now I'm just basically going to now introduce to you the program that you applied for, which is the Pure Dignity Project. What is it all about, the Pure Dignity Project that you applied under? The Pure Dignity Project usually focuses on the rural areas. The aim is basically to promote menstrual health hygiene among adolescents that are in rural areas. So the program will be focused in rural areas with the following objectives. The objectives of the Pure Dignity is 1, to increase awareness among adolescents girls on menstrual health hygiene, build self-esteem, empower girls for greater socialization. That is basically the objective of one of the objectives for the Pure Dignity Project. Another thing is to increase access to and the use of high quality sanitary napkins by adolescents girls in rural areas. And the last objective of the Pure Dignity Project is to ensure safe disposal of sanitary napkins in an environmentally friendly manner. So that is what the project is all about. These are the objectives, the key objectives for the Pure Dignity Project that you applied under to be a menstrual health educator. So now let's look at the package. What is it going to be really doing is 1, mobilize adolescent girls, conduct monthly meetings, provide health education to adolescent girls, conduct women's group meetings, distribute sanitary napkins to adolescent girls. So basically, this is what the Pure Dignity package focuses on. Let me just admit one person. Okay. And then another thing is to ensure that there is regularly fill and supply of sanitary napkins to the village from the center itself that will set up. Another thing is to sell sanitary napkins and maintain accounts, track supplies and estimate requirements for the following month, submit progress report on key indicators, training with youths on menstrual health hygiene booklet, and conduct periodical refreshers. So basically, that's what the Pure Dignity is all about. So now let's move on to lecture 5. This one focuses now on school. Education is basically linked to menstrual health hygiene. Also, if girls and female teachers are unable to manage their menstruation at school, that is how it's now, becomes linked to that's how now we find that menstruation is now linked to education. Girls, when in a case where you find that girls are unable to manage their menstruation, you also see that girls miss classes when they have their periods and may drop out completely, and their performance can also suffer due to stress and discomfort. That is another thing that we look at when we that is another thing we are finding when we link education to menstruation to menstrual hygiene. Now, what is the responsibilities that can come into play? You ensure that there is adequate water, sanitation, and menstrual health hygiene facilities in school. Sensitize teachers and students about menstruation and menstrual hygiene and promote a supportive environment. That is how you can come in as a menstrual health hygiene educator. So now let's look at some of the challenges faced by school girls and female teachers in addition to menstrual health hygiene. You find that there is lack of sanitary protection materials, which leads to embarrassment and stress due to leakage, smelling, and teasing. If there is a lack of sanitary protection, you find that there is also stress that comes into play because of leakage. There's no proper sanitary materials that can be used that can when a girl wears or a female teacher wears feel comfortable and won't experience any form of leakage. And another thing, you find that there is less concentration and participation. That includes not standing up to answer questions due to embarrassment, stress, and concern over leakage or smell and discomfort. So you find these are some of the challenges that girls and female teachers face. And then there is also lack of private facilities and water supply for washing and drying soiled clothes, or hands. If there isn't even proper facilities that allow, you find, in fact, in most setup, I've never come across, unless if it's a boarding school, like a school that actually has in the bathroom there is a provision for a shower. Let's say in case a girl has stained herself, she can easily take off her uniform and wash herself, as well as maybe have a provision where she can also just get to wash a school uniform if it's stained and be able to wear it again or dry it out and continue with classes. There isn't that much provision, unless if it's in a boarding school, then that person can go back to the dormitory and take care of herself. And there is absence due to the lack of facilities and services at school to manage menstruation. Definitely, you find that when women are menstruating, they experience different types of blood flows. You find that there are some at the beginning where the blood flow is very high, and then there are some at the end where it's very high. Now, in cases where it's very high, some might try to avoid school so that they can be able to handle any form of leakage or any embarrassing situation that can come up, especially if I'm going to a school where there isn't even proper water or proper facilities where I can go in secrecy to change myself and clean up myself. And then there is also the fear of using latrines in the case that others discover menstrual blood. Even sitting on a toilet, it's very challenging because blood may drop somewhere else, and then you don't want everyone else to see your blood. So other people might actually have a fear to even go into the toilet, into the latrines. Another thing is the inability to keep clean. In some cultures, girls and women are not allowed to bathe or wash themselves during menstruation. The inability to keep clean. In some cultures, girls and women are not allowed to bathe or wash themselves during menstruation. So guys, if you have any questions or anything, I can't check the chat. You can just unmute yourself and pause me, then you can ask me if there's any question or any comment. Oh, just questions. Just make me stop. And then bloodly smell or the smell of used sanitary pads that have to be taken home for disposal, causing discomfort or stress. Another thing that we're talking about, yes, we might say let's incorporate the reusable sanitary pads, but in a situation where a school doesn't have proper facilities, it means when a girl goes in the bathroom to change now into a new reusable sanitary pads, she has to get the pad that has blood with it, fold it in a plastic, carry it in a, put it back in a bag. Now imagine a situation maybe where you are playing with your friend. You know how at school it is, maybe a boy just grabs your bag and start opening things, or a friend of yours just opens the bag, or anything just happens to the bag. But at least if there are facilities where it can allow a girl child, even if they're using the reusable pad, to actually rinse blood off the pad. At least when the bag opens, there won't be that bloody smell coming out. And then there's also the lack of knowledge. Girls approaching menstruation are especially lacking in information about the process, leaving them scared and embarrassed. There isn't much information given to girls before they actually even start seeing their menstruation, they start seeing their period. People don't actually take time to invest into say, okay, I think this child is heading towards this. Let me prepare them for the process. All they wait for is when it happens, they'll tell us, she will tell us, then we'll figure out something. Even then, when it happens, there isn't much information that is given. And then you find that another challenge is exclusion from sports due to discomfort, concern over leakage, or because of culture restrictions. When a girl child is menstruating, you find that they're also excluded from taking part in other sports or sports activities. Now, let's look at some of the benefits of good menstrual health hygiene in school for girls and female staff. Why is it? What are some of the benefits? You find that more time is spent in school for female teachers and schoolgirls. They get to spend more time in school. Then there is also increased concentration, high self-confidence, increased comfort, good hygiene, less irritation from sanitary materials, and less risk of related infections. And another thing you find is there is great participation and more confidence to actually stand up to answer questions and ask to leave the classroom to use their latrine when they are educated properly, when they have the information that is required. They have that confidence to actually even stand up, answer questions, even feel not and actually not be ashamed to use the latrine. Now let's look at practical menstrual health hygiene interventions in school. What can you do as a menstrual health educator? You can engage with girls and boys in menstrual health hygiene. You can conduct menstrual health hygiene education sessions. We can do formation of girls club, share information on menstrual health hygiene through dialogues with female teachers or trusted female adults. You can, in fact, in your training, you can even incorporate some of the female teachers that you might meet where you go to a school to pitch about what you want to do as a menstrual health hygiene educator when you are organizing for your outreach. You approach the school authorities, you might find some of the female teachers might actually be interested to work with you. So you can bring them on and see how you can work with them. Forming girls club where menstrual health hygiene can be discussed. Also teaching boys about menstrual health hygiene through adolescence lessons for girls and boys. And then another thing you can do is ensuring availability of affordable sanitary protection materials. Another thing you can do is actually providing sanitary protection materials or training on how to make your own. You can facilitate for a training on how girls can actually be able to make their own reusable sanitary pad. So this is the end of lecture 4 and 5. I don't know if there are any questions from the group before I start questioning people now. Are there any questions? Okay, since people are saying it's clear, is it okay for me to ask a question to the class? So just a quick question, like based on so far what has been covered, can just somebody unmute themselves and pitch to me like what are they planning for their outreach that will basically take place end of January till February? Like you just unmute yourself, like based on what I've acquired so far from the sessions, my plan is to do this and this for my outreach. So you can just unmute yourself and just tell me. Okay, now let me just do a call out. Usuma, what is your idea for your outreach based on so far the information that you have acquired?
I had the feeling you'd call me out.
I know.
So basically, already I've already engaged the church near where I live. I live near. If you live on the Copper Belt, you've probably heard of Chipata compound. So I live near there. It's an area that's a bit prone to girls not finishing their secondary education, prone to early pregnancies and all the sorts. So I've already engaged the church. They're just waiting for me to start my program. So from there, I'll be meeting girls from the community where we discuss a wide variety of topics, including menstrual health, sex education, depending on what the church approves. I don't know if there's anything else I can add.
Oh, no, that's very interesting. And interesting enough, I'm actually in the Copper Belt, but definitely I'll DM you and see if we can actually meet. So now I'm going
Thank
to
you. That's
Betha. What's your plan for your outreach? Betha Mchaya. Oh, who else is available? Let me see. Brian Karikeka, what's your plan? Let me pick out on a man, then we can close today's class. Hello, Brian, can you get us? Okay, I can't get Brian, but he has unmuted his mic. Hello. Brian. Okay.
Hello.
Yeah, we can now get you. What's your plan for your outreach?
Oh, okay. I was saying perfect. The presentation has been good, and my plan. I wouldn't actually sell my plans to as a facilitator, lest the members get. So I think on that one, I'll remain mute if I may be allowed for various reasons.
Oh, all right, all right. So
Yeah,
yeah.
but moving forward, adding something, I think we've been those that are glued to ZNBC and all these channels. We've seen an advert by the Minister of is it Information, the chief government spokesperson, Chushika Sanda. There was a component she actually brought out where she was like distribution of sanitary pads for free next year. So that puts what we are doing on a lighter note, and that we will have full support and backup even from non-governmental organizations, because what we're doing basically is what the government is aiming at, and so we are on the right track. And about doing that, I think mobilization is what I personally am doing. Mobilization, much of mobilization, mobilizing people, and then we can get to educate them after we've mobilized the people. And basically that's my addition to that.
All right, thank you so much. I don't know, is there anyone else who would want to comment or anything else? Say just anything before we end today's meeting. Okay, since there are
uh,
no comments. Okay,
may I come in?
yes.
It's just a wake up call for our colleagues that we are actually sharing the information with. uh we ought to take this serious, because we'll have a time when we're going to go in our various outreach, programs, and these are the questions people will be asking. These are some of the uh, things that we are going to be facing in the communities and all that. Okay, so if you miss this chance of taking advantage of these questions and answers that we are actually having, it will be difficult if you are asked in the public or even in a community saying, but we've heard myths around the menstruation and all that. What's your take? You know, so it's important that we get these things on our fingertips. Thank
Yeah, that's very true, and that's a very good contribution. Because at the end of it all, like it's also just a nice reminder to remind people, like, why did you really sign up for this class, and what was your really purpose to say when I acquire the information? Because people are very key on, let's say, I just want to build up on my CV, I want to accumulate a certificate, but then without impact, you just have information. It's practically useless to have a whole package of certificates without proper engagement or putting them to use. So as you take up a course or anything else, it's an encouragement, like at least have a backup plan on what you plan to use the information for, because it's through this engagement that you also get to expand on your network as a young person, also get to engage with other people, and even might even position yourself for possible career opportunities that are out there through just volunteering and putting out every information that you acquire from different free courses out there. You market yourself and make yourself stand out from everyone else. Is there anyone else wanted to contribute? Okay, so guys, the floor is open if you want to say anything. Okay, since the class is quiet, it's good night and bye bye from me. If you have any questions or any concerns, you can just privately text me. So good night and thank you so much, guys, for tuning in today's class.